Morning from Germany, good afternoon to Mongolia, and welcome to the audience wherever you are. My name is Isabel Hartrecht, and I am the head of the Northeast and Central Asia Division at Untitled Foundation in Munich. And you are listening to our Talking Asia Politics series, which we organized together with the South and Southeast Asia Division in the Department for International Cooperation. Under the heading of Talking Asia Politics, we discuss political and social developments in Asia. We point out risks and opportunities for the countries, and we consider the consequences for Europe. In our analysis, we always consider opinions from within the region as well as abroad, and we focus on a constructive dialogue, allowing different points of view to coexist. In 2020, the coronavirus rapidly spread around our very interconnected world, and quickly almost every country reported cases. However, although the virus caused the same disease in each country, there were vast differences in how each country reacted, in which countermeasures were taken, in how the virus spread through society, and very likely also in what its long-term consequences will be. Therefore, we decided to take an in-depth look at the situation in 8 different countries in Asia, and we have asked experts who followed the spread and the consequences of COVID-19 to analyze success and failure of different strategies and to point out short, medium, and long-term consequences of COVID-19 in the region. Finally, we will have one expert of EU-Asia relations who will point out the consequences for the European future and for our cooperations in and with Asia. The result of these analyses is our series Asia Fighting COVID-19. After today, we have 5 more online seminars in the next months where our authors present their insights, and each paper will be available for download. In the second half of this year, we will have a special publication where all 9 contributions will be combined. Today, we will take a look at Mongolia. And before we start, I have some technical information for you. At the low end of your screen, you see a Q&A box. Here you can ask any question concerning Mongolia during the pandemic. And we will try to answer all of the questions during the next hour. So please don't hesitate to ask anything you're interested in. If you encounter technical issues, you can also use the chat function, and our organization team behind the scenes will try to assist you with the troubleshooting. Finally, we will be recording this seminar, and we will very likely publish it on our website later on. Now I'm very happy to introduce today's speaker to you. Mr. Sansar has worked for over 20 years with Mercy Corps, one of the top international humanitarian and development NGOs worldwide. Currently, he is a senior manager for the Program Coordination and Communication Unit at Mercy Corps. During his work, he has implemented various projects and programs in rural Mongolia, and he therefore has in-depth knowledge and experience of economic development, governance, as well as disaster risk reduction measures. He has followed the spread of COVID-19 in his country very closely, and I'm looking forward to hearing his assessment of the consequences Mongolia is facing right now. With this, I would like to hand over to Mr. Sansar. Please tell us which challenges posed COVID-19 to Mongolia and what are the mid and long-term consequences according to your assessment.
Thank you very much, Isabel. Yeah, I'm delighted. It's my pleasure to attend this meeting and introduce you about the COVID situation in Mongolia and how the government handled it. Yeah, you introduced me, and there's nothing to add. You know, I've been working for Mercy Corps since 1999 and traveling around Mongolia, and the focus of my experiences in business, market development, governance, civil society, and disaster risk reduction. Now I have a few slides, a presentation to show you. Just a moment. Okay, do you see that?
Yes, we can see it.
Okay. So I took this. Let me very briefly, tell you about how I wrote this report. I took. I began working on it, and I finished and submitted it to your organization. It was March, I believe it was in March. Yeah, and by March it was the COVID infection in Mongolia was very much under control, but since then it was it got out of control, and I will tell you, describe you the situation. Okay, so a little bit about Mongolia facts. Okay, Mongolia is located in Central Asia, right in Central Asia. It borders Russia and China. Area is huge, 1.5 kilometers. It's size of Western Europe. The population is very small, 3.3 million, and half of the population lives in Ulaanbaatar, which is a capital city of Mongolia. Climate is very severe, continental, very cold winters and long and cold winters, and very short but very warm summers. And 30% of the population are nomadic herders. What they do, that they herd animals, and they move from one pasture land to another pasture land. The economy is mostly based on agriculture and mining. Main main income comes from mining, but main occupation, most people are work in the agricultural sector. Most people, yeah. Okay. So what happened is that when last year in 2020, as soon as the news that in China there was a COVID, a pandemic, the government had a meeting, and then we closed all the border. We declared the state of high preparedness. Yeah, and all the borders were all closed. Yeah, all visits were also stopped. All kindergarten schools, universities, all training centers were closed. And the first case we had was registered on 10th of March. It was a case from abroad. It was a foreigner. He came in March. He was isolated, and we thought it was okay, because since then we didn't report any cases. But then the number of cases began to increase, and until November we had, it was fine. We thought it was the government had everything under control. But in November we had the first case of community transmission, because up until November it was all imported cases, like passengers coming to Mongolia. They brought in infections. Right now, the total number of infections stands at 67,710, and this is yesterday's numbers. And today we had 1,300 more, so we can add it, and it's probably 69,000. Total number of deaths is over 332, and you see the numbers right here. I don't need to tell them all. 88% of all infected, are in Ulaanbaatar, which is the capital city. Since November, we had 4 lockdowns, very strict lockdowns. And the last lockdown was over in April, end of April. And as soon as the pandemic hit Mongolia, we adopted the law on COVID, COVID-19. It was a special law to prevent and protect and mitigate the health of and socioeconomic impact of the pandemic. So we had strict lockdowns. We announced an economic relief package. I will tell you about it later. We also started doing mass testing and isolations. We introduced hygiene and safety protocols. We began repatriation flights because all flights were stopped, but many thousands of Mongolians were stranded in other countries. So we began flying them back in, and we began vaccinations. Vaccinations didn't start until March of this year. I will tell you about the vaccinations now. The target was to vaccinate 70% of the population, which is all people over 18 years of old. And right now, 90% of target group received their first shots, and 75% received their second shots. So it's really we are doing really great since March. We used 4 types of vaccines: Pfizer, AstraZeneca, Russian, and Chinese vaccines. We announced, an economic aid package. In last year, we announced 1.2 billion, and this year we announced 3.5 billion of economic aid to revive the economy. We also introduced tax relief measures for all businesses, and also, people who receive their salaries were exempt from taxes. We increased social benefits and allowances. The state covered all water and electricity bills of all households and private entities. We began distributing subsidies to herders, because for herders, one of the main sources of income is cashmere, goat cashmere. It's a significant amount of income comes from cashmere sales. So we began offering them like some subsidies. The government began buying cashmeres at a fixed rate, because the prices of cashmere went down because we closed the border with China. Also, this year the government began offering low interest loans, which is amounts to 3%. Annual rate is 3%. So we began offering them this year. And last year, we began extending their deadlines for loan repayments. What were the social and political consequences? Well, as you can see, the economy, contracted, by 5 and 3%. The government revenues fell, and and expenditures went up. We depend very much on mineral exports. Like our main exports are coal, gold, and copper, plus cashmere, as I mentioned. And because we closed the borders, the exports dropped, which hit the economy. The average monthly household income decreased by 40%, which you can see it's a huge number. Almost 62% of, more than 62% of all SMEs, they experienced a drastic drop in sales. And we had last year parliamentary elections, and I would call it the consequences was that the current ruling party, Mongolian People's Party, they won the parliamentary elections again, for the second time. I think this is the consequence of this COVID, because people were not allowed to have political meetings, and government began distributing money and increasing allowances and payouts. So it has an influence on on voters' mind, so they voted for MPP. Yes. What else? Yeah, this is very briefly, and the next step for Mongolia is to finish the vaccination program. Vaccination is a key to revive the economy. As I mentioned earlier, 90% received their first shots and 75% received their second shot, so it's not bad. But starting April of this year, the number of new cases increased dramatically. You know, now we are having more than 1,000 cases every day. You know, and we already opened, we already lifted the lockdown. We opened all the businesses. 90% of all businesses opened up, but we still have this problem, very high rate of infections. So this is worrying us. Economic recovery is also a priority. As the new government was formed last January, new government, because the last government resigned, and they formed the new government, and they announced 3.5 billion of economic aid. But I saw the latest statistics, and maybe I'll add it in the report later, that trade and economic growth is going up, which is very good news. But still, you know, lots of SMEs, you know, suffering because they have no clients. Their sales are still low, and they can attract many people. Yeah. So you can start asking questions.
Thank you, Mr. Sansar. Thank you very much. Yes, and that's also the opportunity for the audience to start, you know, writing the questions in our Q&A box, and we will then ask them for everybody. What I would be interested in, because Mongolia was so successful in the beginning. They reacted very quickly. They closed their borders very consequently. Everybody who returned had to do not only a 2 weeks quarantine, but as far as I know, even 3 weeks quarantine. And for so many months in 2020, the numbers were consistently very, very low. What do you think? Why did it get out of control now?
I think it was a government mismanagement. You know, the government thought they had it under control, and there were no vaccines yet in the world. And after 3 lockdowns, we thought, okay, the worst is over. We opened up. It happened at the end of March, and then of course people started mingling, you know, meeting and stuff, and then it just got out of control. It seems like the government was hiding a lot of facts, you know, like even though they said, okay, people get isolated and there are no community transmissions, but in fact the community transmissions were happening, and the government was hiding this fact. Also, there were few scandals, like hospitals. They were providing false tests, you know, like because people who want to travel to rural area, they have to undergo a test and bring like positive results. I mean negative results. Sorry, but it turned out that in a few cases, you know, like the hospital people were lying. They were issuing false test results and stuff like that. This also happened. Also, there was a hotel outside of UB where they isolated people, but it turned out that you know, they mingled, you know, the people who they thought recovered from COVID didn't recover at all. You know, it was so it all was the government mismanagement. You know.
Yeah.
Go ahead.
We already have questions from the audience. I would like to pick these up. What do you think, what households were most vulnerable to COVID-19 or are most vulnerable?
I would say people who lost their jobs, lost their jobs, especially people working for SMEs. They lost their jobs, and they were the most vulnerable now. I would say the very poor people, they didn't, they were not very vulnerable because the government increased benefits, paying benefits to them and stuff. But people from the from the middle with middle income, they were the most vulnerable to COVID. Yeah.
So is it true to say that COVID is mainly a problem for the people living in Ulaanbaatar, in the rather densely populated city, or are the rural parts also concerned?
Rural parts also, because as I mentioned earlier, herders were they were hit with COVID because their main source of income, cashmere, the sales of cashmere, the prices went down. It hit them tremendously. They also couldn't bring animals to UB because it was closed, so they couldn't sell their animals in UB. That was also they also suffered from that. So I wouldn't say only UB, but rural areas as well. And people with many kids also, because they had to stay home and they couldn't go to work. And because schools were closed and all kids had to stay home and study online. And yeah, and their parents had to also stay with them and couldn't go to work. Yeah.
I was quite impressed when you said how fast now the vaccination is proceeding, that actually quite a big part of the population has already received the first shot. So we have the question, what is the willingness like among the population to receive a vaccination? Is there vaccine hesitancy, or are they generally very willing or even eager to receive a vaccine?
I think generally, I would say eager, because almost more than 90% of people, they already received their first shots. So it indicates the willingness of people. Of course, there's always a small group of people who are hesitant, most people were vaccinated by the Chinese vaccine, and many people, they had their doubts, like, would Chinese vaccine work? And many people wanted a Russian vaccine, but Russian vaccine was in shortage, and of course the Western vaccine was also in very much shortage. So yeah, so that's it. Yeah.
The most commonly used vaccine is then the one from China, I assume.
Yes,
okay.
Yes.
So, okay. You also mentioned a lot of data, and in your presentation we had quite a few actual numbers which are very interesting. So we have the question, what is the source of your data? I also suppose that we can then refer to your article where you have the citation of the sources, right?
Yeah. Okay. Most data I received was from the National Statistical Office, Mongolia. Yeah, and also I contacted a few international NGOs like Save the Children, also World Bank, and the World Health Organization. Data was very important. I mean, they're very reliable information. Also, I received information from Ministry of Finance, from SICA, this is a Mongolian NGO, from Friedrich Ebert Foundation, it's a German NGO. Yeah, so I will send you the report again, because since March, when I wrote the report, a lot of things happened. A lot of information needs to be updated. Because can you imagine, like in March, I was writing like, oh, total number of infected people was 6,000. Now it's 62,000, 10 times, you know.
Yeah,
In just 3 months, the cases went up 10 times. This is unbelievable.
yeah. I have two questions concerning the lockdown measures, because I know that you had lockdowns, or you had very strict restrictions throughout 2020 when the numbers were very low. So I would like to know, what was the acceptance rate in the population? Did they support these measures, although they couldn't see or feel the virus? And the second question is, were the measures, or are the measures everywhere the same, or do you have specific measures for Ulaanbaatar and then other measures for the countryside?
Okay, we had 4 lockdowns. First lockdown was at national level, and then there were no cases in the rural areas. So second and third lockdowns were mostly in UB, but there were 4 or 5 provinces that also implemented the same lockdown as UB, because they had cases. Others, you know, didn't have many cases, so they had very mild, I would say, mild quarantine, you know. The lockdowns were harsh because we couldn't I mean, we were allowed only to visit the nearest store. That was it. We couldn't do anything else. And it of course had a very positive result. But in March, when we opened up again, the shit hit the fan, you know. I'm sorry for the phrase. And yeah, we thought we contained it, but we were wrong, you know. Yeah.
How was schooling during the time, or how is schooling? Was it possible to do online schooling? How did that work?
Yeah, it was it depended, you know. Last September and October, the kids went to school, and then in November we had the first lockdown, and all schools, colleges, universities were all closed, and the kids started doing online trainings. Again, in UB it was better because they had they had Wi-Fi's and internet connections. In the countryside, especially when you have a herder, you know, herders, they send their kids to the nearest county, you know, nearest village, and sometimes they don't have very good, reliable internet connections, and for them it was very difficult. Yeah. For instance, my kids, they were fine because we always have internet, but again, people who live in the outskirts of UB, you know, and people who are poor, they don't have computers, you know. So for them it was it affected them very much. And for kids it was difficult because doing online trainings is not that good, you know, than compared to when you do classroom trainings, and they don't see their other kids, they don't see the teachers. So I'd say the quality of education probably suffered as a result.
Are there any plans or programs to make the catch up to school, the input, the lessons that were lost during that time? Especially for children in the countryside.
Exactly. There are no. There are talks. Yeah, talks that. This year we plan to start a little bit early in the middle of August. Usually we start on the 1st of September, but this year we will start a little bit early. There are talks that kids, especially the primary school kids, they might get additional training, but still nothing approved. Nothing. There's nothing for sure. Yeah.
And it was, I suppose, in Mongolia, it was probably also the first time that something like online classes has even been tried.
Yeah, exactly. Like because of that, like even teachers didn't know how to teach in these circumstances. So they had to improvise. The lockdowns began last year. You know, last year the second half of the of the year, you know, they were on lockdown, and then we had summer. In summer we opened up, and then we had September and October. Kids still went to school, and then again there were lockdowns. You know, so we had lockdowns twice. You know, so.
You also mentioned that during the lockdown, your circle where the places where you can go are restricted. You can only go to the closest shops. So
Yes.
was there any problem with food availability in the store? So was the food supply chain, was it interrupted at some point? So
yes, it was interrupted. Shortage of food. I mean, nothing serious. You know, if you in the 90s, okay. In the 90s, early 90s, when the communist system went down, and we had real shortages of food. That was really scary. This time it was not that scary, but still lots of shortages and inflation, and because borders were closed, supply of course went down, and with the supply, prices went up, and yeah, it affected us.
So what do you think will be the long-term social consequences of the pandemic in Mongolia?
We're still trying to figure it out, you know. It's okay. For instance, for kids, I would say for kids, it's they lost a year, you know. I would say they lost a year. Maybe they managed to recover only 40% of what they lost by online trainings, but still, it's very difficult to measure. For SMEs, they all lost a year because they lost sales, they lost. I mean, all 90% of SMEs, they had loans, and they struggled to pay loans. That's for sure. Also, lots of people who were sick but didn't have COVID, they also suffered. They like people who used to go to foreign countries to get treatment, they couldn't do it. They suffered. Also, people who were sick, you know, with other diseases, they couldn't get the treatment in the hospitals because all hospitals were busy with COVID. They also suffered, and yeah. The mining, I think it was we had a drop, but later it caught up, you know, because Chinese market is our key market for our commodities. China recovered pretty well, so we began selling them our commodities. So trade went up and stuff, which is good. But for SMEs, it was a very, very difficult year.
I also heard that because of the border closures, a lot of Mongolians were stuck abroad and had difficulties returning, or it was and maybe still is very difficult. Do you have any information about maybe how many people are still abroad, or are they all being brought back now?
I can give you the accurate information maybe later, but I know that we managed to bring like about 10,000 people. But they're still being flown back to UB, to Mongolia. I know that the border is now opened officially, and people now can fly out and in. But still, there are very few international flights because other countries also closed their borders, you know, with us. So this passenger flights, you know, are still rare. Many Mongolians, yeah, they suffered a lot. Many people who went to you know, study in other countries, they couldn't return. Many people who went to get treatment, they couldn't return. They, you know, many of them they took lots of loans, you know, couldn't repay. So it's a nightmare. Yeah, it's very difficult for them.
Was there any assistance, like financial assistance from the government for these people?
Not for the people who were stranded, like as far as I know, nothing. Just promises that they will be brought back, in time, but nothing substantial, no.
I would like to ask a question about politics. So this pandemic proved in many countries that times of crisis benefit the incumbent government. And you have also mentioned that during the election or at the elections in 2020, the incumbent government won the elections again. But now they have resigned beginning of this year. So what happened, or do you think this has something to do with the pandemic, which I think it has.
Let me give you my opinion, okay? It's just my personal opinion. I think it was a political game, because okay, we had two elections. Last year, summer, June, we had parliamentary elections. This year, now, today is also in election day. We are electing the president. So we have always two elections every 4 years. And last year, the ruling party that already won in 2016 won again, because they promised, oh, we are protecting you from COVID, and we're doing a lot, so people thought, okay, and they voted and they won again. Last, I think it was in January. Yes, January there was a small scandal. Like there was a mother, with a newborn child. She was tested positive, and she was taken to another hospital for COVID patients. But when she was taken, there was some negligence, mismanagement. She didn't wear warm clothes, so journalists took picture of her, and then there was a scandal like, okay, this is how the government handles COVID crisis. Back then, the government, resigned, but I think they did this just to the prime minister did this to run for the presidency. The candidate from NPP, he was the prime minister back then, so he resigned. This is just my opinion, that he resigned to give him some time to prepare for the presidential elections.
So do you think that the pandemic threatens the democracy in Mongolia?
I don't know. I mean, it's up for discussion. People warn that if NP wins again, if they win the presidential elections, then they will be ruling everything, dominating, and but I don't think so. Democracy in Mongolia has already been established, yeah, and it would be very difficult to unroot, to destroy the democracy. Yeah, some people might have a tendency to rule Mongolia in a hard way, but I think we have opposition parties, we have free press, and I think it wouldn't happen.
Do the people in general trust the government and approve of the measures?
People trust, yeah. But you see, with COVID, because we can't demonstrate, we can't go and we can't take to the streets, we can't demonstrate. It's hard to measure, Maybe people want to protest, but everything is prohibited, because of the COVID measures.
In Germany, we have some people who believe in conspiracy theories, and these people deny that COVID even exists. Is that a thing in Mongolia? Do you have that?
No, no. Yeah, there were some conspiracy theories in the beginning of the pandemic, when people were on Facebook. You know, people were asking, "Oh, in 2019, I had this flu, and I think we already had this virus before, and probably that's why we don't have many cases." It was in 2020. You know, now they all understand that they were wrong, because they see number of infections and number of deaths. But back then, yeah, there were some people believed in that, but not anymore.
Mm-hmm. It is one of the assumptions that Asian people are better equipped to cope with lockdown measures because they're more focused on society than they are focused on individual, like we supposedly in Europe are. Do you think there is some truth in this assumption?
Assumption like Asian people, um, you mean follow the rules and laws
Care
and stuff
about
like that?
society and therefore are more willing to follow the rules than
Yeah,
Western society.
I can't talk on behalf of all Asian people. No, I don't know. Mongolians, yeah, we it's a mix, you know. We, on one hand, yes, we, like, when all those strict measures were introduced, we began wearing masks, keeping distances and stuff like that. So in this case, yes. But on the other hand, Mongolians are famous for not following their rules and laws. You know, we are like, we have still have this free nomadic spirit in us. So we say, oh, no, just, I don't care, and then we just go and do our own things. Because we were told not to, like, gather, and have meetings, but we still do it informally, even during lockdowns. And that's how this COVID, this infection was out of control, because secretly we were still meeting, like big family meetings, and drinking together, like, this all had their influence.
Mm-hmm.
Mhm.
So to turn a little bit to now, how is Mongolia planning to rebuild? You mentioned in your talk, but also particularly in your article, that Mongolia receives a lot of support and financial assistance from international organizations in other countries worth over 400 million US dollars. Can you give some examples how this money will be spent or what the plans are?
Okay, most of the money went to buy equipment, testing equipment, vaccines, also to renovate hospitals. Yeah, it was spent mostly on that. There was some money that provided by ADB, that to support the economic growth. Yes, but most money went to fight the COVID. Like buying masks and supplies and stuff like that.
Mm.
Mhm.
Mongolia is also part of the COVAX initiative and receiving vaccines. But do you think that the EU should or could do more to help Mongolia?
Yeah, if I know that the situation in EU is improving, but hasn't improved. Hasn't European countries have not recovered fully. So I think EU still focusing on themselves. But of course, yeah, I would like EU to help more, especially, and I would say not just supplies and equipment, but maybe trainings, maybe trainings for medical staff, training for ordinary people, like how to, because most people have very vague idea about this virus. You know, they still think it's a kind of flu, the flu that, and that's yeah, that's why we have very high rate of new cases now.
Mm.
Mm-hmm.
Yeah, we all have seen that, of course, the virus doesn't stop at country borders. So what is Mongolia's point of view when it comes to international cooperation in the region to prevent epidemics or similar risks? So which are there any organizations that, from Mongolia's view, would be suitable to harmonize crisis response?
I think you mean the Mongolian partners, right? Who from Mongolia? Yeah. I would say National Emergency Management Agency and the Emergency Committee, you know, of government Mongolia are the two most best suited organizations to handle this crisis. If we there are many organizations, you know, that are related to COVID, but it's better if the coordination was in one hand. So the most suitable organization, I would call it NEMA, or National Emergency Management Agency. Yeah, they are best equipped to handle, you know, manage those pandemics, you know, manage pandemics and human and animal pandemics, for instance, and other emergencies.
And does Mongolia work together with its neighboring countries, like particularly China and Russia, when it comes to epidemics?
Yeah, I believe so. Yeah, and we have very good cooperation with the World Health Organization, and thanks to WHO that we can take measures early. World Bank, I would like to also say thank you to World Bank for helping us, you know. So we'll play with all those key organizations, international organizations. And I believe that we have very close communication with our Chinese and the Russian counterparts, you know, constant communication. That's why we were able to close the borders when nobody else closed the borders, you know. We were the first country to close the border with China. And while in Europe, in America, I mean, the borders were still open. That's why it hit it hit them very hard, you know.
So what would you say was your biggest disappointment, and what was your biggest positive surprise in fighting the pandemic?
The biggest disappointment was that how government handled the crisis I would say in the end of 2020. Yeah, they did a lot of things that they lied to us. I mean, the facts I mean, they loosened the control, and I wouldn't blame them 100%. It was a new experience for everybody. Yeah, so that was my disappointment. And you said, what was the second question? The positive results?
Positive surprise.
The positive surprise. Oh yeah, vaccinations. We received the vaccination, the first vaccine at the end of March, and now we vaccinated almost 90% of the Mongolians. So it's a surprise, and also the fact that people, you know, we had 4 lockdowns, and we took them seriously. We didn't revolt. We didn't take the streets. We didn't fight. You know, we said okay, and we followed the government instructions.
Do you, with the vaccinations, do they have a priority list? Like, is our first old people prioritized, or
Yes.
yeah?
They were like first. Okay, the priority was the first people to vaccinate was like people, like medical staff, doctors, nurses, also people who worked for emergency agencies, and then police, and then older people, and then middle-aged people, and then now we are vaccinating young people. Yeah, and we plan to vaccinate kids, not very young kids, but maybe kids between 12 and 16 or something like that. Yeah.
Mongolia also experienced very severe winter conditions in 2020, 2021 that killed many livestock. So did COVID-19 affect the assistance to herders?
I think yes. I think so. Last winter was very harsh, and we heard news that many animals died, but it was all overshadowed by the COVID crisis. So no one paid attention to them. No one paid attention. Of course, still we distributed help to the herders, but not to the same extent as we used to do. So herders, they suffered. Yeah.
Mm-hmm. Are there also, I mean, there are some, companies, mainly international companies, who benefited from the pandemic, for example, Amazon or the streaming service Netflix. Are there any industries in Mongolia that have benefited from the pandemic?
Yeah, like internet providers, television channels, like the same as in the West, like whoever was supplying all these computer, IT, whoever was distributing movies online, they all benefited. I think they made they did good. Yeah, I think they did good.
Is internet access has internet access spread? Has it become more common because of the pandemic?
Very common. We learned, the new ways. We learned to manage our businesses online. Like myself, I was locked down in my apartment, and I did everything, in the distance. I'll talk to my boss, using Zoom and Skype, and so we learned the new ways of doing our business in these new circumstances. Yeah, and you should know that almost more than 90% of Mongolians, they have cell phones, and one or two. So yeah.
Okay, I just see we have one more follow-up question on the before mentioned reduced food supplies. So was this more an issue in Ulaanbaatar or also in the provincial and district centers?
Group of what? Of what population?
The reduced food supplies during the lockdown.
Yeah. It also affected the rural areas, because we buy meat from rural area, and we buy a few vegetables. Everything else, or most of other food, comes from abroad. So and it comes through UB. So rural areas, they were also affected. We didn't go hungry. Yeah, Mongolia would never go hungry with 70 million animals, but it affected our food quality, because less vegetables, less other supplies, less oil, for example. So it affected the quality in both areas, UB and provinces.
Okay, so then I have one last question, and that is, has this pandemic changed Mongolia, and if so, how? Definitely changed. People realize that it takes one wrong decision, and then the whole country, the economy, the livelihoods of people can go and crash, and it just highlights the importance of
of partnership, between government, between businesses and ordinary people. We have to do everything in a coordinated way, and the government has to make, like good decisions, and not populist, but real good decisions. Otherwise, many people would suffer, and yeah.
Yeah, I think everybody here hopes for that the government will make the right decisions and that Mongolia will be able to win over COVID and win fast. So with that, we are reaching the end of our seminar. Mr. Sansar's article will be available for download on our website very soon. And please also sign up for our following seminars. Next week, we will have a look at India's fight against COVID-19. Please also feel free to stay in touch via our email address, asia@hss.de. Via this email address, you can ask us to send you all the articles of our Asia Against COVID-19 series. You can also sign up to our newsletters in the South and Southeast Asia division, as well as the Northeast and Central Asia division. asia@hss.de is our address. So with that, I would like to thank you, Mr. Sansar, for your fantastic input today. Also would like to thank our organization team behind the scenes. And I would especially like to thank everybody who signed up for you today and for all your interesting questions. When you sign out now, you will see a very short survey. Please fill it in and help us improve our future seminars with that. Thank you, goodbye, and see you next week for India.